So this was going to be her nursery. We've gotten some toys and some onesies. Even friends have given us a bunch of hand-me-downs. I'm very anxious this whole pregnancy, so I didn't really like to come in here, really, to be honest. I was scared for most of this pregnancy. This was the special bear that the high-risk doctor gave us with her heartbeat in it. You like messing with that, don't you?
Yeah, it annoys you.
I like it, but it's also very upsetting too.
Sometimes there aren't words to describe a grief this deep. A young mom supposed to be celebrating the coming birth of a new life, instead mourning it. Forced to travel hundreds of miles from home in order to save her own life. Since the fall of Roe v. Wade, whole regions of the country have plunged into uncertainty surrounding laws restricting abortion access. Patients face harassment, potential lawsuits. Doctors face fines, suspensions, even prison time. In many places, anti-abortion advocates say there are exceptions to the bans. But what does it take to qualify?
Do we have to wait until they are septic and have uncontrollable infection, have an ICU admission, need multiple blood transfusion, at the brink of organ failure before we intervene? That's not how we practice medicine.
What does it mean to be on the brink? And what is the cost of the lives in the balance?
I shouldn't have to be on my deathbed for you to consider my life as important as my baby's life.
At 22 weeks along, it's painfully obvious that Alexandra is pregnant. What you can't see is the heartbreak behind her smile.
Really pretty.
This is a last-minute maternity shoot for the 31-year-old Texas mom. In just a few hours, she and her husband Blake will leave for Washington, D.C. to get an abortion.
I guess that's one thing that I'm grateful for, is that I'm able to have this time with her and know there's an end near, but I can enjoy her last days. It's hard, but I'm thankful for it.
It's a tragic end to a much-wanted pregnancy. One Alexandra wanted so badly, she took on a second job to afford IVF, a baby girl named Aurora Grace. And while she is confident in her decision, she did ask us to change their names to avoid harassment for speaking publicly about this very private journey.
This is her little head and her nose. This is like her mouth area, but her hand was in the way. I went to a high-risk doctor, and they did an anatomy scan. I was almost 20 weeks, 19 weeks in a few days. The first thing he said was, I'm seeing a lot of abnormalities here, and she's not compatible with life.
In all, there were 4 different abnormalities. Altogether, there was no chance of survival, especially with one being Potter syndrome, where critical organs don't develop.
The kidneys are not functioning, which caused no fluid. You have to have fluid for a baby's lungs to develop. So in essence, she wouldn't be able to breathe when she gets out. With all of them together, it just wasn't right. I think my health is what I'm scared about the most, just because no matter what, she's going to be gone. But I still have a family that I need to live for, and my son needs me, and I just want to stay healthy.
In addition to the fetal diagnosis, Alexandra had other complications. A few weeks ago, she started bleeding. She hasn't stopped. She also has something called placenta previa, which can cause severe bleeding closer to delivery.
What did the doctor say about the risk to your own health?
He was like, something needs to be done now. They were very scared about hemorrhaging or, any complications. I called my husband on the way home and was like, meet me at the house. I talked to him about it, and he's like, no matter what, we're saving you first. He's like, we love this baby, but if she has no quality of life, there's no reason for us to drag this on longer than it has to be.
When did you know that something was wrong?
I always had like mother's intuition, like there was something wrong.
When you're getting the news that no expecting mother wants to hear from the doctor, and you're not getting any answers as to what more you could do and what your options are, did you understand why in that moment?
I did afterwards, and that was very frustrating for me because the whole word abortion was not in my vocabulary because I personally don't believe in it, but it's never been something that I've ever really thought about in depth. You know, like, I'm not that political.
What about now?
It's not just yes or no. It's not black and white. There's definitely gray areas that should definitely be considered, and not some government telling you that yes or no.
For someone living in Texas and all across the southern part of the country, abortion is largely banned. And for someone in their second trimester, finding treatment gets even harder.
You're a nurse. You help people every day. Did you get a sense that your doctors were afraid?
Yeah, definitely. It wasn't that they didn't want to help me. They were just nervous about telling me where to get the help.
Dr. Shelley Tien knows what that's like. On this day, Dr. Tien is in Kansas at the Trust Women Clinic.
Hi, Dr. Tien, nice to see you. Good to see you too.
Okay. You did great. Going right through here, my dear.
As a board-certified OBGYN who specializes in maternal fetal medicine, Dr. Tien is an expert in high-risk pregnancies. She's also an abortion provider.
Why do you believe it's essential to provide abortion care?
Safe abortion care is women's health care. It's necessary health care. And suddenly we are in a position where we're scared to talk about it. Physicians and healthcare systems are wondering, is she sick enough to meet that exception? Can I act now?
Dr. Tien goes to Kansas for a few days every month. She also works part of the year tending to high-risk pregnancies in Arizona.
Do you need me? Yes. What can I do for you?
But her home base is in Jacksonville, Florida, which means Tien spends an extraordinary amount of time in airports and on planes.
You know, on a typical clinic day, we will wrap up usually by 5 p.m., but that can also vary. I do always have a backup.
Florida's Republican-controlled government passed a 15-week abortion ban that could soon become a 6-week ban. Dr. Tien is one of the plaintiffs challenging those restrictions in court.
So today, in regards to staff, we've got everybody here. AD today. We've got Fearless Tien, 27 consults. A lot of consults today. 5 MABs, 4 surgicals.
Can I come in? Okay, you're all set? When I talk with patients, you know, I tell them pregnancy is very much a stress test for the body. It's a stress test for the heart, for the lungs, for the kidneys, for the pancreas. So patients that already have pre-existing medical concerns, that pregnancy can really worsen those health conditions.
My name is Vanessa. I'm a single mom from Pensacola, Florida. I have an autistic 6-year-old son, and I am here for a medical abortion.
Vanessa asked us not to show her face. She nearly died after giving birth to her son when she was just 19 years old.
My blood pressure would not go down for like about a week straight. I had a stroke just the day after I had my son. It was a very scary situation. I didn't know that I was actually having a stroke.
Vanessa's blood pressure is still an issue, making pregnancy dangerous. She was in the hospital just days ago.
It just kind of feels like you have no other choice up there but to have a baby once you get pregnant.
On the same day, we also met a woman we will call Jenny.
I don't have headaches. I have stage 4 kidney disease, and I have very high blood pressure, and I also a type 2 diabetic. And my age, I'm 42 years old as well. So I'm a very high-risk pregnancy.
Like Vanessa, Jenny was also recently hospitalized. She says this doesn't feel like much of a choice to her either.
It's like life or death. Like, I'm on a kidney transplant list now, but if I continue with the pregnancy, I'll get kicked off the kidney transplant list. I'm already sick, so if I were to just continue with the pregnancy, I would have put my life at risk, and then at the end, the baby may not survive.
All of Jenny's doctors recommended termination.
She did great, so her procedure went very smoothly. She's getting cleaned up and she's going to recovery. The exceptions to the abortion ban in many of these states are confusing, vague, and truly just woefully inadequate for how complex and nuanced pregnancy complications can be.
If Florida gets to impose a 6-week abortion ban, both of these women would have to get incredibly sick to qualify for an exception. They would have to be on the brink of death. Back in Texas, that's something Alexandra refuses to let happen to her. Up next, her heart-wrenching journey halfway across the country to save her own life.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.